Hello, everyone. Dr. Nikhil Verma here with another episode of Things I Didn't Learn in Med School. Tonight, I wanted to present to everybody a presentation that I gave at the 2022 American Academy of Physical Medicine and Rehabilitation. I was invited by Dr. Timothy Tu to join his panel of attending physicians in different fields of medicine in the regards of different practice styles. We discussed a private practice model. That was my portion of the presentation. We discussed a academic slash private practice model, and one that was purely academic, and how one can help navigate through those and what steps are involved. I found it to be a very thoughtful experience for myself, something that made me really crunch down and think about different aspects of my career and where I'm at right now. And I figured it'd be a good presentation for anyone out there that might be interested. This may be a great resource for people that are looking to go into private practice, or residents and fellows that may be considering going into private practice in the future, or even if you've been in practice for a while and you want to consider switching over. Hopefully you find this information useful. And if you do, please share it with somebody that someone else that may find it useful, or someone else that might find it intriguing. Unfortunately, I don't have the slides or access to the other individuals' portions of that lecture, but hopefully if this is what you're looking for on my channel, hopefully you find it useful. All right, so here's the title: Private Practice Starting from Scratch. Many of you have already connected with me through YouTube, Twitter, and Instagram. I've changed my handles to DRNV Sports Spine. LinkedIn, you can find me there. There is another Dr. Nikhil Verma, who is a fantastic orthopedic surgeon in Chicago, Illinois. That is not me. We look a little bit different. Very similar trainings, but he's an orthopedic surgeon and I'm not. So just make sure you click on the right one. Follow him too. Why not? My website, as you guys know, and also, as you guys know, is I've built a brand based around authenticity, calling things how I see it. And that allows me to do what I want to do in the private practice world. And I don't have to answer to other individuals or get my social media things signed off from a higher up somewhere. And this isn't necessarily saying that all those people that do overlook things are bad, but there are more rules you have to follow, especially the more academic you get. All right, a bit about my training. If you don't know who I am, I don't put this slide out there to make myself look like I'm the most knowledgeable person in the world or brag about myself or anything. The purpose of the slide is to show you the different places I've been throughout the years and the different practice models I've been throughout my training, and why I feel like I'm somewhat competent to talk about these concepts. As many of you know, born and raised in Ohio. I went to Ohio State for undergraduate. Pre-med was my focus area. Biology was my major. I was exposed to a little bit of private practice and stuff around that time. Med school, I went to St. George's University. It's a Caribbean school. That took me actually to Newcastle, England for my first year, where I was part of the Keith B. Taylor Global Scholars Program. So I was exposed to different hospital systems, different clinical techniques, different philosophies, as you will, from the European side of things, or at least the English side of things. From there, I went to Grenada for my second year of clinical rotations. And again, during our clinical rotations, we were exposed to the Grenadian side of medicine and how things function down there, which is also quite the experience. I did my core rotations in Brooklyn, New York at Lutheran Hospital, which is now NYU Hospital in Brooklyn. And in this atmosphere, obviously, you learn how that hospital system runs, how their private practice typically operate, how their clinic operates, et cetera, et cetera. Also, when I was doing my core rotations in Brooklyn, I decided to do other rotations at other hospitals in New York City, or in Brooklyn, Brooklyn Hospital Center, Kingsburg Jewish Medical Center, where I ended up doing my residency, and there's a few other ones. Woodhull was another one. So there's a handful of hospitals that I was at, Methodist in Brooklyn as well. So just to name a few. Intern year was at Wayne State University in Crittenton, the Crittenton branch in Rochester Hills, Michigan. I did a transitional year there, so we were exposed to different types of clinics, different hospital settings. Also, it was not just the Crittenton Hospital, but we also did our VA rotations at the VA in Detroit. So, different hospital systems, different settings there. Residency, again, Kingsburg Jewish Medical Center. Learned different styles from different attendings. We went to different clinics. We went to different hospitals in themselves in our rotations. So, there's a handful of more. Fellowship, though, that's the first time I actually started thinking about this. I did my fellowship in Birmingham, Alabama, at Alabama Ortho Spine and Sports. We rotated at two different hospitals, completely different hospital systems. We did our procedures at least 3 different surgical centers and at least 2 other hospital pain departments. And our clinic was a freestanding orthopedic practice clinic. And then, I started my journey on my attendinghoodship and started doing locums as of January 21, as I was starting to build up my own practice. And I was doing locums, here and there until about the summer of 22. So that's kind of where my background is. Again, this is just to show that, I've been to different places. I don't say I've been to all the places. I've seen everything, because I clearly have not. But I think it's important for people to realize that I wasn't one of the people that went to the same medical school, that went to the same residency, that went to the same fellowship year after year after year. I feel like this exposure helped allow me to understand different dynamics of the healthcare industry. One of the big topics that I talk about a lot and other people talk about quite often is, you can only pick 2: lifestyle, money and compensation, or location. This was taught to me at an early age. I thought this was an important thing to think about. You can try to make them all fit, but it doesn't always work. So just keep that in the back of your mind. I added peace of mind because I feel like this isn't talked about enough. And it overlaps with lifestyle somewhat, but I feel like this was the biggest thing for me when I ultimately made my own decision. So just, something to keep in mind and think about. So the next thing is, when I was doing this lecture, he asked us to put pros and cons into it, but I ultimately decided, I can't speak for someone else. What is a pro, what is a con, and what is neutral? So this is kind of my opinion on things. So I have an unlimited ceiling as a private practice physician, meaning I can work as hard as I want to work, and my own limitation is time. That's all I can put in, is all the money I can get on the back end. And, there's even ways to manipulate that, not manipulate in a negative sense, but use time to your advantage. And there's different ways to get into that, especially in the private practice world. I'm the ultimate decision maker. I don't have to answer to anyone. Decisions are made through me. Is that a pro? Sometimes it is. Is it a con? Sometimes it is. So if something goes bad, it's going to be my fault. It's easier to take on new business opportunities at the start because you have more time to do such things. But at the same time, it's also hard to get into business investments as easily because time and money is a limited resource. You get to structure your life and how you will run your practice, how you like it. You can do locums, you can do side gigs, you can do other things to help pay the bills as you're building up your practice, as I did. But some people want the stable paycheck every 2 weeks, every 3 weeks, every month, or whatever it might be, to pay the bills and make sure that they're investing and all that stuff. So it does change budgeting. You have to understand billing and coding. That's another major fact that nobody really talks very much about. I know I talk about it a little bit. I'm sorry that the slides kind of look like this. I guess it's just a aspect ratio thing. Hopefully it's coming out okay. Building a team, it's another important thing. It's hard to just go in right to private practice and try to go out by yourself 100%. You need a good accountant. You need a good lawyer. You need a good business manager. You need an MA. Those are some of the bare minimums that you need to get your practice up and running. You need a billing and coding company. You don't necessarily need that off the beginning, but you need that to be taken care of. You need to have a good relation with other physicians to get some sort of referral source coming to you. So just some things that you have to think about. Some more pros, cons, neutrals. You work your own hours. That could be good. That could be bad. Some people like the structure, or other people will work the amount of hours they feel like needed to work, and then they're ready to go home and take care of the things that they need to take care of at home, which is just as important. Funny little joke that I always say is what can go wrong will go wrong. So if you don't take care of it at the beginning, that's fine, but it will bite you in the butt later on. And it's a lesson that I keep learning and keep reintroducing myself. And but that's just reality. It's worth the time to fix small problems at the beginning so they don't become big problems at the end. Liability. All the liability falls on yourself. You don't have the structure to back you up. It's always going to be on you, especially if you hire advanced practitioners alongside with you. Their liability becomes yours, or at least yours in the sense it's your practice. The other thing is all the compensation does go to you or your company. Now you have to decide how to divvy that up. Will that go to staff? Will that go to overhead? Will that go to paying yourself? Will that go to advertisement and patient networking, et cetera, et cetera? So things to think about. Setting up proper business structure. This is something I knew nothing about in medical school or residency or fellowship. And it took a long time to get set up. And ideally, you want to set yourself up as an LLC or an S Corp for many reasons. I'm going to get into this briefly in one of my future videos, so stay tuned for that. Taxes can get very, very messy very, very quickly, both on personal and business side if you're not doing things correctly. That's part of your similar team is getting a good bookkeeper, making sure that you're keeping the books properly. You need to have a good HR team on that same side, which can help with both the team side and hiring, firing, but also can help with taxes and personal business taxes, both on the personal business side. So other things, home ownership, it's nearly impossible to get a loan if you go straight into practice from fellowship or residency. You will get denied because the loan companies want to see 2 years of stable income and 2 years of tax returns. There's ways to get around this, but I can assure you that I have not been able to qualify for a loan being out of fellowship for 2 years now. You get some benefits of business write-offs, medical supplies for the office, portions of transportation, and some indications. Anything that you would wear to work that you would not wear outside of work. Funny little story. You see all these fitness people out there that say, oh, I can just business write off all this fitness work. You cannot do that. That is illegal. That is not what the IRS says that you can do. You can, and if you do, put your own logo to advertise, then you can use that. But if you use clothes that you could wear in other occasions, it's not a business write-off. So keep that in mind. But there's other things, of course, going to conferences, a percentage of the meals you go to on business occasions, sometimes 20 to 35%. Don't know the exact numbers off the top of my head. Those are some pros, but the cons are, what if you write off the wrong thing and then you get audited from the IRS, and that can end up costing you tens of thousands of dollars in the long run. The benefit of going to conferences and societies, I have more flexibility to pick and choose the ones I want to go to, and I get to go to. And the membership dues are write-offs for the business as well, but that can get mightily expensive. And if you're not utilizing those conferences and societies, then it's probably time for me to start closing the books on some of those, and that's fine. That's the decision you have to make. Networking meeting. If you're an extrovert like I am, then it makes that portion of it fun, but it can be exhausting as well. If you're an introvert, it's very, very difficult to get those network meetings up and running and getting people to engage with you and be potential partners or be potential referral sources, or just, recommend you to anyone that's come across the street. I'm not saying it's impossible, but this is a case where being an extrovert does help you out. I've noticed that it does take a lot of time and energy to do these things, and I find myself to be more and more exhausted doing these things, but it does matter. Again, advertising, as I discussed, you have to understand how search engine optimization works, not even at a low level, but at a pretty significantly high level, how Google ads work, how Facebook ads work, how YouTube ads work, how Instagram ads work. These are all crucial parts of being competitive in the market. Is your website compliant? That's something that Google will go and review your website. And if they find you not to be compliant, they will block you from being on ads on their website. So patients wouldn't be able to find you if you type their name in. On their ads portion, you would still be able to find that practice if you were just to say search the practice by name. But if in that AdSense, they will block your ads. Buying into surgery centers, I've noticed the past few months, actually the better part of this whole year, they don't respect you because you don't have much to offer them at the beginning. And that makes complete sense. You can't have people come talk a big game and not provide what the surgery center is looking for as far as a profitable individual and as far as a person that is kind, respectful to others respect you, et cetera, et cetera. I know I'm skipping over some of these, so please be mindful of that. If you do have questions about the ones I do skip over, feel free to message me on the social media platform. Drop me a question on the YouTube channel as well. Office maintenance is another big thing. I have to keep tabs with the cleaning services, making sure that I have enough supplies, making sure that we aren't running out of soap in the bathrooms, making sure that we have air fresheners, make sure everything looks clean, neat, and tidy. All these things matter. And if something breaks, you have to go fix that. Renting versus buying is another big thing. Do you want to rent your space out from somebody, or do you want to buy something bigger and not have to worry about that overhead? Loans in general for your business can be a little taxing and tricky. HR, payroll, varies state by state, very intensive information. Great thing there are companies that can outsource this for you now, but it's still important to understand yourself so you're not getting burned. Social media presence, it's not an absolute needed thing, but it's something that's probably one of the biggest indicators of you being differentiated from a bigger hospital group or anything. And nowadays, honestly, you're seeing big hospital centers put stuff on social media a lot more heavily. Nationwide Children is putting out educational videos almost every week that pops up on my Instagram. I see it on Facebook ads. I see, all over the place. So these are other things to think about. You need to be competitive in that field. So you need to find a time and budget and a way to do that. Again, outsourcing is a good option for this, but everything you outsource does cost more money. Profit and loss statements is important for you to keep track of accurately. You can hire a bookkeeper, again, outsourcing, but as well, you need to know how this is run. Working holidays and weekends. I've missed more holidays the past year than I have in probably since med school. And that's even pushing it because I think med school, I had most of the holidays off, at least the holiday days. Weekends, I have probably worked every single weekend this year. I'm trying to think. I don't want to overstate because there are a lot of weekends that I've gone to conferences or I've done other things, but there's definitely a few hours, Friday, Saturday, Sunday, each I'm working on something or for the practice's sake. Not working holidays and weekends. When you get to a point that you're stable enough, you don't necessarily have to work those holidays or weekends. But on the other side of the spectrum, if you're not choosing not to work those days, your practice isn't making money, and your revenue won't be as well off. You're a small fish in a big pond. Most of the times, you don't play nicely with the bigger hospitals and the bigger systems. They don't like to play nice to you. They won't refer to you. In fact, it's one of those things that they get looked at, scrutinized if they are not referring to your specialty. So, for example, if I had a GI practice that was a private practice seeing patients, and I wanted Dr. Brown from across the street to send me patients, but he works for the big corporatization hospital, he would be dinged from his superiors if he referred a patient to me and not to someone within the network. So this is where the Managed Care Associations, the Managed Care Act kind of really disservice not only the patients, but the private practice physicians as well. And we talked about not getting into business investments as easily. So briefly, I want to talk about too, like what's my typical workday. And you'll see when you do up all the math, it's way over the 80 hours a week. So I wake up at 6 a.m., usually do some meditation, some stretches, maybe fall back asleep for 10 or 15 minutes before we start the day. Really what it is, it's just an hour of time to clear my mind before I start the day and see what I have to do for the day. I go to my office around 7:15, so 7:30 to 9, I'm doing administrative work, calling patients. I'm doing insurance reviews of the claims, making sure that things aren't getting held up, answering emails, et cetera, et cetera. From 9 to 3, I'm pretty much seeing patients. I don't take a lunch break very often. I have an hour in there, but I'm usually working through it. As we unfortunately learn in medicine to eat while we're working. Hopefully one day it won't always be like that, but that's where I'm at right now. Between 3 and 4, I'm finishing notes. I have some meetings. I'm calling patients. After that, I drive into the gym. So during my ride to the gym, I'm calling people, setting up other meetings or setting up next day situations I might need to take care of. So I work out. I have dinner. And then whenever I'm done with dinner, I don't have a time frame there, but whenever I'm done with dinner, I really just start my administrative stuff again. Sometimes I shoot these videos. Sometimes I'll be cleaning up things from the notes from the day or reviewing MRIs and x-rays that have come in, answering patient questions, et cetera, et cetera. So that's a typical day, more or less. My work week, every Monday, Tuesday, and Friday, I'm in my Columbus office. So that's, a little bit closer to me. It takes me about 15, 20 minutes to get there. And I kind of try to stay there longer because I have more time to stay there in the afternoon. Wednesdays, I'm in my Marion office, so it's an hour commute each way. That's an hour of time that I could be seeing patients. So it's something I have to think about. How many patients can I see in an accurate way with giving good care and doing the right thing in that hour? Is that 2-hour commute worth it? X amount of days a year? Something to think about. Thursdays, I kind of reserve for my procedure days and administrative days. So I do in my office about once a month, a surgery center in Columbus twice a month, and then a surgery center in Marion once a month as well. This is my typical work week. I have about 8 to 15 procedures every Thursday right now. Not nearly where I need to be a fully sustainable practice, but I end up using the rest of that Thursday to do more administrative work, more meetings, more networking, going to meet other practices as part of the networking process, drop off gifts to providers that have already been providing referrals for me, such as cookies or coffee or tea or whatever the front desk may want. Usually the physicians are really busy. Try not to bother them that much if I can help it. So it's noteworthy. I'm essentially alone. I do have an MA and an office administrator that helps a little bit. I outsource billing and prior authorization. But I'm involved in all of it. I outsource my HR as well, but I'm involved with all of it. Every decision does come through me. When something goes wrong, I'm the one that answering that phone. I'm the one fixing it, or at least finding a way to fix it. If you start delegating everything from the beginning, they will rob you blind. They will be not only the patients, but the employees and the insurance companies. It'll all turn out very poorly. The current 9 to 3 that I'm working with this only works because I have that much patient volume right now. It's not a long-term sustainable career path. It will not keep the doors open in the long term, and I'm well aware of that. This is where I need to start getting more patients in the door with more advertising, more outreach, and then I start thinking about more ways to see more patients, whether that means hiring more medical assistants or nurses or getting APPs involved as well. And that's something I need to decide a few months prior to getting that busy. Or I'm that busy and then I'm starting to turn patients away and say, come back in 2 months when I have this staff. So, these are big decisions you have to make. Yeah, and I do need to increase my practice about 200%. I'm just doing some rough math right now in my head. That would put me at a decent number as a single provider. And then anything above that, around that is probably when I would need to start having way more help than I can think of, but at an expense that I'm spending for more salaries. So just keep that in mind. This is the question. Should you go into private practice? It's a question that you can only answer yourself. I don't know. But my opinion is always probably, especially as more hospital systems and more private equity firms and more insurance companies such as Optum who are paying doctors to be Optum, if you don't know, owns UHC, or UHC owns Optum, sorry. And they're partnering with doctors to be preferred physicians in the area. So you get all those patients go directly to you. But this doesn't always translate to the best care for the patient, because something I do isn't something that Ohio State does, isn't something that Ohio Health does. And there's also things that they do that I don't do. So it goes both ways. But in the care spectrum, we should be offering the best things for our patients. I talked about, I couldn't take over some of these other or I couldn't take some patients from some of the private practices because they're getting dinged. It's a major problem in the industry, and hopefully we'll get band together to help it out. Patient care should always come first, and the private equity groups and these big hospital systems are limiting that, and they limit the time we can have with our patients too. So, and when you do sell a practice to a private equity or hospital administration, that physician tends to lose more money than actually seen. And I say that by your practice might sell for a significantly high amount of money, but every year you work for them, your actual compensation dwindles down. And there's been several studies this year that have shown that. So that's the reason why you should go in private practice. Here's the big but behind it. I recommend you need at least $250,000 free cash. Some people say less. I don't think that it would be a wise choice, especially if you want to pay your staff and pay yourself and make sure it's done correctly. You might need another 100, 200K of money to use. So I usually say to 500 to be safe. That'll get your office up and running. That'll make sure your salaries are paid for, your own salary included. That'll make sure that, the startup costs are a little bit higher, and then your monthlies go down a little bit every year. And the idea would be, that loan would be paid off before 10 years, probably sooner. So that's just something to keep in mind. And there's different ways to fund this as well. Everyone always tells me this: you won't be profitable as a business for at least 2 to 5 years. So do you have enough cash stored away? And that's where that $250,000 of free cash comes from. It comes a lot of budgeting. That's why you need a good financial planner. The contracting will crush you. Even if you have a contracting company that'll help you, it will crush you because your first contract is what it is, and there's no room for negotiations. So just keep that in mind. One of the concepts you can do is sign a contract in network with a hospital system, so you get their contracts as well. But they have no reason to advocate on your behalf to improve your contracts. And here's the big thing: is you'll work harder than you've ever worked before. I've been to residency. I've been to med school. It's like those two things combined, because not only am I learning the new information, I'm learning how to run a business. I'm also learning and staying up to date with the most relevant facts in the medical world. And so many things are coming at you at all different directions. So this isn't for everyone. And, there have been days and months and weeks that I've thought about switching careers or switching to something else. But I'm enjoying this a lot, what I'm doing right now. And I don't have a reason to quit, at least in October of 22. Maybe that'll change. Maybe it won't. I don't know. This is one quote from one of my good friends back in high school. It was my freshman year, and he had already gone through two-day summers. Back then, we did the 2 days in the dead heat of August, waking up at 6 a.m. and heading out there for back-to-back 3-hour football practices. But he said, it's like, at the end of it, he's like, I asked him, like, what should I expect? He goes, you know what? It's the most fun you never want to have again. And when you think about it, that's kind of how I see this. It's a lot of fun. It's hard. It's stressful. It makes your head hurt. Sleepless nights, graying beards, balding, poor sleep, all that stuff. But it's a lot of fun. And I'm really enjoying the process, and I'm really enjoying learning new things every day, and really helping other out that aren't able to have the access to these kind of things. So that's where that kind of comes in, because now that I've done this once, or I'm doing this one time, I thoroughly believe if I ever go to another business, I would be way more suitable and understanding of how to start and run a new business. And then if I were to do it again, it would be much easier that time. So as we know, repetition is the master of all skill. But so the most fun thing that I would never want to do again, kind of. So again, my information, we can connect. Feel free to drop me any comments or questions here. Feel free to reach out to me on social media, the Instagrams, the Twitters, LinkedIn, and there's my website. All right, everyone. Hopefully you guys find this useful, and we'll talk soon. And if you guys are finding this useful, please share it with people that would also find it useful and find it enjoyable. All right, everyone. Take care.